All right, everybody, 7:33, and this is an important topic. Medicare premiums expected to rise sharply in a couple of months, and seniors who rely on the benefits will have less to choose from because insurers are now scaling back on some of those plans.
That's right. 69 million Americans rely on this coverage, and open enrollment is currently underway. This morning, we're joined by Dr. Oz, Mehmet Oz, who serves as the administrator at the Centers for Medicare and Medicaid. So, Dr. Oz, thanks so much for taking time out of your morning to be with us. We appreciate it.
I'm honored to join you. And just to put a little buffer on this issue, although some of the prices are going up, some are going down. The best way to know if you're getting the best on your Medicare is to go to Medicare.gov, or we can go 800 Medicare if it's easier to talk to somebody, and actually find out. And that's why open enrollment, which we're discussing today, is so critical. Is the one time in a year where you can go out there, change your plans, make new decisions, ensure that the medications that you're on are best covered by whatever program you're signing up for. This year, you've got some new features that might help you identify the right doctor for you. But you can't do it if you don't join the movement. And this is the crown jewel of our social safety net program, Medicare. Everybody agrees Medicare is a good deal, but you got to get involved to take advantage of it.
Well, before we get to all the changes, though, a lot of folks are probably wondering, because of the government shutdown, is that going to have any impact on Medicaid and Medicare payments?
Hazel, none whatsoever. Medicare and Medicaid remain intact and not affected by any of the arguments happening. Frankly, Medicare is one of those things where most people just agree it's a good thing to have, which is why open enrollment might bring us together this year.
So you're talking about costs coming down, but there are areas where it is going up, right? The cost of Part B premiums are jumping more than $20 from next year, $185 to about $206.50, which is a lot, right, for seniors on a fixed income. So can you explain the jump?
Well, we're not sure what the jump's going to be yet. These are all still hypothesized numbers. We don't decide for another couple of weeks. The Part D, which is the part most people who are watching right now are going to care about, that's your out-of-pocket expenditures for, and the premiums for when you go out and buy medications at a drugstore or get it from a pharmacy. Those prices are actually going down a little bit. And interestingly, the Medicare Advantage prices are going down a little bit. Part of that's because we've been negotiating so aggressively. The president charged us with going out and protecting seniors, so we went and called the insurance companies, called the pharmaceutical companies. You probably saw in the news last night, we're doing a bunch of these most favored nation pricing deals where we go to the pharmaceutical companies and say, listen, we're not going to pay you more for Americans than you are getting paid for Europeans or Asians. If drugs are made, for example, in the same factory, in the same box, in the same facility, then we're going to make sure those are priced the exact same way. So that's actually bringing some of these prices down.
So you're saying that it may not jump $20 because they haven't been set yet, but it could be that high? You just don't know yet?
We're not sure yet. But again, Part B is that's the money that we spend for medications that doctors give you. The bigger program that most people care about is the Part D. D is in David. And those prices are actually going down a little bit.
With all these changes, though, who should actually be taking a closer look at their coverage, and how long do they have to make a decision?
If you're one of the 69 million people on Medicare, you need to look at Medicare.gov, or again, call somebody at 1-800-Medicare to make sure that you're got the right plan for you. It changes every year. And we've got lots of new features this year. But if you sign in and actually make an account for yourself, we can give you detailed information based on the medications you're on, the doctors you're seeing, so you know how to do this the right way. And the deadline is December the 7th. But tell your friends now. One beautiful thing about seniors is that we have an opportunity to communicate with each other, and folks do talk to each other when they're older. And so spread the wisdom. Go to 1-800-Medicare, call somebody if you get some details, find out exactly what's going on that might benefit you. You could save hundreds of dollars by doing this the right way.
Yeah, December 7th is the key date. Dr. Oz, I appreciate you coming on to talk about this important area. But while we have you here, I do want to ask you to clear up some claims made by Health Secretary RFK Jr. regarding the link between Tylenol and autism. We heard a lot of our viewers were interested in this. You went so far as to encourage pregnant women to not take acetaminophen. So do you believe that claim? Can you clear the air for some of our viewers right now who'll be saying, should I take Tylenol? Should I give children my Tylenol?
We made a decision at the beginning of the administration to be radically transparent. So as soon as we hear news, we share it with the American public. And there was an article published based on pretty good data from Harvard that made all of us concerned that we were overusing Tylenol for smaller causes. Listen, if you've got a child with a fever, if you're having significant pain, talk to your doctor. And of course, you can take Tylenol. Frankly, it's one of the few options you have if you're pregnant. But if you stub your toe or if you have low-grade temperature and it's not a big deal, then we don't think you should feel that Tylenol is the safest thing out there. In fact, and by the way, Tylenol is the brand name. It's called acetaminophen. That's the raw material. That's found in a lot of over-the-counter products. Just check, read the label, and don't panic. If you're worried, talk to your doc. But I think most folks should get comfortable not treating minor aches and pains, because there is nothing that's completely 100% safe if you're pregnant in that setting.
So was he wrong to say it? Because it came out as if there was a link between taking Tylenol or giving your child Tylenol and autism. Was he wrong to make that correlation?
No, Secretary Kennedy wasn't wrong at all. In fact, he was bravely saying what I think a lot of folks have been thinking, which is, if my wife was pregnant right now, and she had a low-grade temperature of 100 degree, and we didn't think that anything significant was going on, she had little sniffles, then we wouldn't take medications for that. Part of the reason this has become so commonly accepted to be safe is because no one actually went back and checked the data. Even the company itself that makes these acetaminophen products has said that we don't know enough about what it does during pregnancy for you to feel comfortable taking it without any concern at all. But there's risks if you have really high temperature. If you got bad pain, you ought to talk to someone about it. We want to find what the causes of those are. And sometimes taking acetaminophen is the right decision.
Okay, so we know where you stand on that, but what about, do you support the health secretary's claims that circumcisions can also be linked to autism?
Again, that data was based on information that was looking at what happens to kids who, probably it's not the circumcision, but what they take for pain medications around it, but we don't know. And these are not causative. These are associations. If you look at all the kids who have something done, what happens to them a year or 2 or 5 later? And that's part of the challenge. In order for us to know for sure whether there's really causation between these different events, you'd have to wait 5 years and do clinical trials.
So why say it?
It's just not
why say it before the studies come out? Why say it? If it's not definitive yet, why say it?
Because we've decided to be transparent in everything we find out. Otherwise, folks think we're holding secrets. So when we find data that's interesting, we share it, and that folks can make out from that information what they desire. But we don't want folks thinking that there's hidden data out there that doesn't affect them. And you're not going to know for sure in some of these instances for years, because there's no way to do a clinical trial and figure out what's actually happening. In some settings, we should do the research, and we're investing $50 million additional money into trying to figure out what's happening to autism. But then the real question is why do we have so much autism? When I was growing up, I didn't know any kid who had autism. I don't know where the other 65-year-olds. By the way, I just joined Medicare myself, so I'm actually a participant. I'm enjoying the fruits of my labor because I'm a beneficiary of Medicare. But I don't know any other kids when I was young, and now I don't know any 65-year-olds who have autism. So some things changed. It could be in the environment. It could be other factors that are impacting us, the age of the parents. But we've got to get into this issue in a more serious fashion. Americans are asking for some help in this area. It's become a major problem when the incidence is now 1 in 31 children.
Yeah. Well, Dr. Oz, we have run out of time, unfortunately. We, again, appreciate your time laying out everything for the deadline for Medicare and enrollment. Thanks again.
God bless you. Take care.